Now in your health news this morning, it is time for this week's Better Health segment.
Asante health expert Beth sits down with an expert guest to talk about COPD.
Chronic obstructive pulmonary disease, or COPD, makes breathing hard for the 16 million Americans who have been diagnosed with it. But millions more suffer from COPD who have not been diagnosed. Dr. Mohammad, how is COPD diagnosed, and what are the signs and symptoms of COPD?
So COPD is usually diagnosed with a slow onset of cough and shortness of breath. Usually the cough is what we generally call a smoker's cough. The shortness of breath can be gradual. In the beginning, usually experienced only with exertion, with heavy lifting, and then gradually worsens. Patients with COPD tend to have frequent episodes of bronchitis or what we call chest infections, and usually happen to be smokers or exposed to other risk factors for COPD.
So are there certain risk factors associated with COPD, and once you discover that, how is it treated?
So the most common risk factor for COPD is cigarette smoking. So the great majority of patients that we see are, current smokers or former smokers. But there are other important risk factors that we have to consider. So there are some genetic factors. So usually individuals who have COPD at a younger age, have multiple family members, should be screened for genetic disorders. One most commonly known is called alpha-1 antitrypsin deficiency. People at high-risk occupations, usually firefighters, especially wildland firefighters, are at high risk. And there are some other occupations where there's heavy exposure to smoke or chemicals that could cause COPD. It's very important to diagnose COPD properly, and that usually includes a lung function test. So that's important to have done to make sure we're not mistaking the diagnosis. When it comes to treatment, there are different categories of treatment. So when it comes to medications, there are different types of inhalers that help open up the airways, improve airflow, and decrease inflammation. But we also like to focus on other aspects of therapy. Things like pulmonary rehabilitation is a very great asset where we have one-on-one coaching and education and kind of exercise programs to kind of have a comprehensive approach to treating COPD. We like to talk about nutrition, smoking cessation, early detection of lung cancers. So there's a lot of aspects that we can work on to improve the life and quality of life for someone with COPD.
It's great information, and you mentioned smoking cessation. We want to let people know out there that the Great American Smokeout is on November 19. So if you're struggling with COPD or stopping smoking, please get information on the Great American Smokeout. Thank you, Dr. Mohammad, for that information.
Thank you, Beth.